Welcome back. We're talking with Laura Sylvester, whose 4.5-year-old son, Elliot, was diagnosed with autism 2.5 years ago. Why don't you tell us a little bit about his progress?
Well, the first thing we did was put him on a gluten and casein-free diet. That was in the book that my mom sent me. Actually, halfway through the book, I took away gluten and I took away casein. He's never had any since. He became much more aware of his surroundings. He used to actually hit his head on the hardwood floor, and he stopped doing that. He also used to hand flap and look at the lights, and he stopped doing that within 3 weeks into the diet.
Just with the diet? You didn't have to change his behaviors or have him stop doing that?
No, and one of the things when you treat autistic kids is usually you try a lot of different things all at once.
Right.
And it took us 3 months to get any behavioral services started, and that was the 3 months we did the diet. So I always like to talk to parents and say it really worked because there was nothing else changed.
Did you see results right away?
It was about 3 weeks.
3 weeks.
Yeah, and we went to visit my parents, and my parents were amazed at how different and more aware and more social he was. And then we've just continued on the biomed journey since then, and he gets better and better all the time.
Wow.
Now, Dr. Woeller, is this a typical response to a dietary intervention like that?
It really is. It's amazing. I tell parents all the time in my practice, this is one of the things that you can do that's free, other than just changing the way you eat, is to put your child on a gluten casein-free diet. Now, for people who don't know what gluten and casein is a protein found in wheat, casein is a protein found in dairy. Now, many people carry a sensitivity to it where they actually have an allergic type of reaction. But for many kids on the spectrum, the gluten and the casein actually has more like a drug-like effect. It acts like an opiate drug. So they call them glutamorphines and casomorphines because it actually interferes with brain chemistry. And when you pull these kids off these foods, it's like their whole world opens up to them. And usually it will kick in about 2 to 3 weeks into it. So it's been a very, very effective therapy.
But you said it has sort of an opiate effect. So in effect, does the child, as you're pulling this out of their diet, do you do that slowly, or are they feeling like an addiction type feeling?
So glad you asked that, because when I say I took them off immediately, that's not the recommended way to do it, because a lot of these kids do actually go through withdrawals. Wow. So we didn't have withdrawal symptoms, so we were okay, but you really actually want to do it slowly.
So it is common that they can just crave what it is.
Oh, sure, absolutely. One of the things too is you hear a lot of kids have a high pain threshold. Well, basically, if their body is taking an opiate drug, they're not having pain. And many times their pain threshold would decrease the longer they're on a gluten casein-free diet because things are starting to normalize in their body.
So is it they're just not feeling the pain, but they're actually could be harming themselves and they're not feeling it? You know, if they were, you know, for example, to get burned or something.
Or banging their head
or
against
banging
the wall.
their head.
Yeah.
They don't feel it at all, but they could actually really be harming themselves.
That's right.
Wow. That's amazing.
Now, what about just straight one-on-one behavioral modification and interaction? Because I've heard that a lot of parents with autistic children have had success along those routes as well.
That's pretty much the mainstream medicine way. When you go to the pediatrician and they say, yes, your child has autism, they say you want to get behavioral therapy, speech therapy, and OT therapy. And we do all those things. I believe the biomed treatment makes the biggest difference. But because their brain has been affected, they have to learn things in very little steps. We worked on the difference between big and little for 8 months. The concept of big and little took 8 months for him to learn. So it's definitely, you have to add that in.
You have to do that. And then this whole concept of chelation, which seems to be a practice that a lot of alternative medicine doctors are now adopting. Have you done this with Elliot?
We have. You know, chelation is actually a term used. Chele is the word for claw. And what you're doing with chelation is essentially you're detoxifying the body of toxins. In this case, we're using chelating agents, DMSA, DMPS, which are prescriptive medications, to remove toxins and remove heavy metals. There are natural chelators as well. Chlorella is a natural chelator of mercury and these types of things. And we have been implementing this with Elliot for quite some time. And it's been a very, very successful therapy for many, many children.
Now, you know, we have here sort of what appears to be almost an either-or situation. You have a child who's normal, quote normal, and then a child who's autistic. But, you know, there's a whole range in between. We talked about Asperger's syndrome, and we talked about different ADHD and ADD. Would a chelation program have benefit to a, quote, normal child or a child who's further along the spectrum?
Absolutely, and that's why it's called a spectrum. because you're looking at a spectrum of disorders. I mean, the diagnostic criteria for autism is pretty rigid, but there's a lot of kids who fall on that spectrum. He may not meet all of those criteria. But the bottom line is that many of them are affected by the same toxicity. There's a statistic that shows that 1 in 6 kids today have some sort of neurodevelopmental disorder. 1 in 150 have autism, but there's 1 in 6 that have some sort of neurodevelopmental disorder. That's quite alarming. You know, where is that coming from? It's because of toxins.
Because of toxins, and we all know that you know, our environment is full of toxins, and it's not just children who are being affected, but just virtually everybody. And so that's kind of one of the take-home messages today. And in fact, as we wrap up the show, we'll be back with our take-home message right after this.